Great. Hi, everyone. Welcome to the webinar of the Outcome Harvesting Community. My name is Carmen Wilson Grau, and I will be your moderator today. I'm an independent consultant specialized in outcome harvesting. I am the daughter of Ricardo Wilson Grau, who developed methodology together with other colleagues, and I am based in Guatemala. Together with Jules Geers and Connie Hoytink, I am one of the outcome harvesting community facilitators. Jule could not join us today, but Connie is here with us.
Hi, as Carmen said, my name is Connie Hoytink. I'm based in the Netherlands and also working as an outcome harvesting consultant. I think that's
Thank you. Thank you, Connie. As Outcome Harvesting Community, we organize these webinars every month. If I'm not mistaken, this is the last webinar of the cases that have been presented on outcome harvesting that were also presented during the American Evaluation Association conference last November. If you have an interesting outcome harvesting case you would like to share in a webinar, please write us an email at facilitators@outcomeharvesting.net. This is already webinar number 9. We started in January this year. And if you have missed one of the previous webinars, you can find them on our website, or you could visit also our YouTube page, where we share the recordings of each of the webinars. Before we start, I want to mention that the webinar assumes you already have a bit of understanding of what outcome harvesting is, and we will not go through the basics of the method. It will be people sharing their experience in applying outcome harvesting within an intervention. We kindly ask you to keep yourselves muted and keep your camera off during presentations. If you have any questions during the presentation, you can write them in the chat, or you can also raise your hand and we will address them during the Q&A session at the end. This webinar is also being recorded and it will be made available to the outcome members and on our website, as said before. For this webinar, we have 20 to 25 minutes of presentations, which will be followed by Q&A. So I'm pleased to welcome our presenter of today, Heidi Scheffer. She's the founder of Advancing Change Together Consulting, and she's also the chair of the Outcome Mapping Learning Community. She will tell us today about her work with the Alliance for Healthier Communities and Indigenous Primary Healthcare Council, who are working to build organizational equity, inclusion, and culturally safe healthcare organizations in Ontario. She will share the ways that outcome mapping and outcome harvesting were adapted and combined to support the Ontario Indigenous Cultural Safety Program in 2018. Their goal was to influence transformative changes in their health system boundary partners and develop a participatory and learning-oriented monitoring approach to surface the unpredictable and hard to measure organizational outcomes. That said, I hand it over to Heidi.
Thank you. Now, am I sharing my screen?
Yes, please, go ahead.
Great. Oh, strangely, I don't see that. There we go. Okay. Sorry about that. Hello, everyone. Thank you so much for inviting me to present. And also just to say that I have very recently handed over the chair role of the Outcome Mapping Learning Community to two of my colleagues, one very active in this community, Richard Smith, and Jeff Mateus. So I'm now a steward of the Outcome Mapping Learning Community. And I'm very excited to share this presentation, and I've adapted it a little bit in order to, I think, bring out more of how outcome mapping and outcome harvesting were used together at the request of the facilitators of the community. So you will hear terms like boundary partners, the progress markers, and I'll do my best to explain those for people who don't have a background in outcome mapping. First, just an acknowledgement of my, I'm very sorry that I'm doing this presentation without my colleague, the evaluation manager at the Ontario Indigenous Cultural Safety Program. And that is part of the Indigenous Primary Care Council, also supported by the Alliance for Healthier Communities, where I worked for 8 years and I'm now a consultant. Unfortunately, because of the crisis in healthcare and also the limited resources, to be honest, that are funded for Indigenous health, something like coming to share is not a huge priority and not something that she could do, but has given me permission to share a bit of their journey. Also to say that I live myself in the Mississauga territory of Alderville First Nation, and I'm very grateful for living in these lands that have been taken care of for time immemorial by Indigenous people, and also my commitment to work with all of the kind of diverse Indigenous communities that are, as an ally and as someone who disrupts anti-Indigenous racism wherever possible. This is a slide I love to use. It's from a project on health equity indicators. It talks a bit about the journey in health equity. So most of my work is in equity-focused health and well-being, community-based services and program organizations. And what this shows is, what health equity means, which is, providing these priorities for people-centered as they're needed. And it also shows empowerment. So how do we remove the systemic barriers entirely? So in this, it's sort of funny to have a ball game, but here we no longer require supports for the audience, and service providers are able to fully see who they're serving. And it's a metaphor. The challenge is, what do we do when the barriers are systemic racism, when they are things like privilege, bias, intentional bias, white supremacy? And that's where we really come into a very difficult time and opportunity to figure out, how do we support this kind of work to transform persistent racism, and particularly in the health system. And clearly, the only way to do that, and Connie mentioned this in the morning to me, the nothing about us without us, we have to privilege Indigenous leadership at every level. The challenge is that health system is huge, and the health system organizations are huge. This work that I'm presenting is part of a movement for Indigenous health in Indigenous hands. And anti-racist organizational change in health is just part of that movement. Community health centers and other organizations use all of these tools. They use Indigenous cultural safety training, which could be called anti-racist training. They're learning a lot about race-based data collection and intersectional disaggregated data use for health inequities, and lots of quality improvement frameworks and so on. This is an environment that is highly performance oriented, highly high stakes, measurement of health outcomes, and the outcomes are very downstream. And so with the cultural safety training, there's lots of rigorous kinds of Indigenous-led research and evaluation that demonstrates what the outcomes are. And I just wanted to briefly tell you what the training includes. This is a background. So all healthcare providers, I think 12,000 were trained back in 2016, 2017, ultimately twice or double that by now of healthcare providers in Ontario. So they learn the history and legacy of residential schools, the United Nations Declaration on the Rights of Indigenous People. They learn about the treaties. They learn about Indigenous teachings and practices. They learn about intercultural competencies, conflict resolution, and anti-racism. And as I mentioned, there's loads of research that's led by Indigenous people for Indigenous people to try to demonstrate these changes in health outcome. There's huge disparities in health outcomes for Indigenous people, from particularly for women and mental health and all kinds of things. But rather than focus on that, I really wanted to just take a moment to focus on the strengths of this movement for Indigenous health in Indigenous hands. There is a really profound model of health and well-being for primary health care that is Indigenous-led. And in addition to that, there's a belief in the wisdom of elders, of traditional medicines, of ceremonies, celebrations. There's a perspective that's grounded in culture, and not just being part of what Aboriginal Health Access Centres and Indigenous healthcare centers do, but culture as treatment. And clearly this Indigenous health and Indigenous hands movement is very much, a part of what the Indigenous Cultural Safety Institute or program, pardon me, is trying to do, to bring to their health system partners. So when we use the word boundary partners, I want to point out that the Indigenous Cultural Safety Program were unable to really measure their work within the context of the traditional key performance and quality improvement indicators, things like, access to services or healthcare experience. And so they started to experiment with outcome mapping as a way to really understand how they were building relationships with large health system organizations to really improve awareness around colonialism and anti-Indigenous racism, and what some of those results were. And so what I'm going to be reflecting today is a bit of how they adapted both outcome mapping and outcome harvesting in their work. And the key area that I was brought in as a consultant was to support the Indigenous Cultural Safety Program in doing an outcome harvest for the component of their work related to organizational partnership and collaboration. And the challenge with that area of work is that that work is very context specific and very unplanned and emergent, even though there is a rigorous evidence-based Indigenous-led framework, let's say, for what Indigenous cultural safety looks like in an organization. It is not a kind of sequential linear process. It is a highly complex, highly context specific, emergent and unplanned approach. And so while the ICS, I'm going to call it ICS for now on, program they started to experiment with outcome mapping, they found very quickly that outcome mapping could not be used in the way that it was originally intended. So this is where the beginning of an Indigenous-led adaptation started. Because in outcome mapping, the boundary partners, those who work with directly to influence change, those that are aligned, that are going to carry change outside of your sphere of influence into their spheres of influence, they need to understand what that decolonized journey looks like. And they can't understand it without having sort of deep transformational change themselves. They can't understand it from a colonized mindset. So they need to work in relationship. And so what the ICS staff did was to identify specific individuals within these large organizations to work with and to build these kind of transformative relationships with. And so having done that for a period, and I'll get more into that, but having done that for a period of years, they invited me to come and support them to come back to outcome mapping and see how they could map what they had accomplished. And it was an opportunity to bring in an outcome harvesting approach, but again, an adapted outcome harvesting approach, because the focus was on harvesting within the system of the organizations and within the system mainly of the outcome mapping boundary partners, that is the key partners as the primary users of the outcome harvest. So let me just give an overview of this process, and as questions occur to you, please put them in the chat so that we have time at the end to talk about them. So first, we did an outcome harvest with a subset of boundary partners, those that were highly aligned and who identified as primary users of the harvest. And then we were focusing on some of the unplanned outcomes that, really demonstrating some of the contributions that were indirect as well as potentially unwanted, but normally wanted because we took an appreciative inquiry kind of approach to data collection for the harvest. And in this process then of being able to see, here are some of the outcome descriptions, here are some of the contributions and the significance of the changes we've made in our boundary partners in cultural safety. Now our boundary partners can look at an organizational level and create outcome challenges. Outcome challenges are sort of the highest level of vision that an organization can have if they're fully resourced and fully supported to realize the journey. You know, we talk about this idea of knowing there's a journey to take, joining with others to take a journey. The outcome challenge is when the journey is owned, it's institutionalized, it's led and owned by the organization itself. And so by seeing where they've come from using outcome harvesting, they were able to then come back to an outcome mapping approach and say, okay, here's what ideally our organization looks like a few years from now. Then taking that outcome challenge, deriving useful questions to frame the next outcome harvest monitoring approach. So this sort of ongoing cycle, and then looking at what is harvested and how that informs the outcome challenge, and once again, the harvest. I know there's probably questions here, but we'll pick them up at the end. So I'm calling this kind of Indigenous-led adaptation of outcome mapping and outcome harvesting kind of relational learning oriented and emergent. So the approach that the ICS team took with their direct boundary partners was highly relational. They built these trusted, deep relationships. In some cases, they brought senior officials, or in the case of Health Quality Ontario, there was an equity team that were kind of change makers to begin with, already bought into the idea of really advancing inclusion and equity. And they took them on tours to Indigenous Aboriginal health access centers, and really built that deep relationship of trust between those teams and the Indigenous cultural safety team. So that's these transformative change pathways that kind of emerge through this ongoing work. So even the ICS program itself, they didn't develop progress markers, that is developmental, behavioral, transformative change indicators, if you like, markers that they were going to monitor with their partners. They didn't do that because they allowed those relationships to be learning oriented and to emerge and to lead so they suspended an outcome mapping approach, though they at an internal level had an outcome challenge, what they wanted to see in a large organization in terms of them decolonizing, including and hiring more Indigenous staff, etc. That was not something they shared with the organizations. They worked in this sort of grassroots level. So there was this opportunity, to work with the boundary partners to integrate outcome harvesting results within an outcome mapping journey, if you like. And so I'm going to move on here, but I do want to say that clearly this is an adapted outcome harvesting approach, because outcome harvesting, you would be harvesting outcomes in the broader system. Social actors would be beyond just the boundary partners. So, so the harvest was really within the boundary partners as the primary users. They help to identify the process use and the outcome uses for themselves. So while this question is framed around the extent to which the program were able to build the capacity of the boundary partners, the boundary partners themselves were interested to know the extent to which capacity had been built for them to then go on and influence change. So it worked. There was another question as well, and there's more detail about this case, which I feel needs to really come from the ICS program themselves, if we could eventually find some support for them to write this case up. They used an appreciative kind of inquiry approach to focus in on, what the boundary partners and the ICS staff felt were working well, and that was the main data source for a lot of the harvesting work. So let me share an example I'm going to share a few examples of outcome descriptions that came out of the process. So one is, and I put this visual here, which I think was probably a mistake, but just to make the slide more dynamic, but the visual doesn't have that much to do with the outcome description. What it does show is that with age standardized mortality, we see a huge difference in mortality rates in Northern Ontario and Southern Ontario, and most Indigenous people and populations are living in Northern Ontario, and there's a decreased life expectancy. So, you know, clearly very important and very urgent disparities. Here is an example of where there's an annual conference with thousands and over 2,000 healthcare providers who come to learn about quality healthcare, and they were and have continued to have a land acknowledgement as a beginning to those meetings. And why that's significant is because it really reminds people about the truth of the land and the sort of lasting impacts of colonization. And it's also a reminder that comes just as people are beginning, you know, big meetings where they're really thinking a lot and making decisions. And it's possible that they, you know, will be encouraged to be more consistent about their work to decolonize and, you know, to reduce or eliminate anti-Indigenous racism. So in this case, this is a direct outcome contributed by the Indigenous Cultural Safety team that coached both the CEO and the Chief Communications Officer to be confident to deliver those. And maybe I went a bit quickly, but just to say that the land acknowledgements have continued within the organization since 2017. And something interesting again that was done was that the boundary partner, the health equity team within the Health Quality Ontario, harvested progress markers retroactively. So they harvested these changes in the adoption of this practice of Indigenous land acknowledgement and incorporating kind of reconciliation actions into their meetings. And then they map those sort of as a sequential or a transformative change pathway. And this gave the organization itself evidence to demonstrate and scale change across the organization to say, you know, this is what it looked like at the beginning. We were having, you know, we were doing this at staff meetings, and, you know, slowly we build our capacity, and by the end, we've got this organization-wide capacity. Now this is something that could have been mandated, but it wasn't mandated because to be mandated, it would not have the same effect. Truth and Reconciliation calls for action. There are 98 in Canada that have been out about 5 years now, and very few have been acted upon. So there's real urgency here. And something like land acknowledgements are pretty, you know, easy to take action on. I'm going to go on now to talk about an indirect outcome and example. I see there's some chats. I don't know whether I should be looking at the chats, but okay, I probably shouldn't because I'll get distracted. So now this is an indirect outcome because this is an example of an outcome that was contributed to within the organization. So this was in 2018, and the Health Quality Ontario quality standards were able to adopt a set of principles demonstrating the effects, or not demonstrating, but alerting people to the effects of colonization on health outcomes for First Nation, Inuit, and Métis people. And this was in the standards for opioid use disorder and opioid prescribing, as well as opioid prescribing for acute pain and palliative care. And the contributions were that this quality standards team, they had taken the training, the ICS online training, and also really were influenced by this health equity team, really gaining support from executives and the standards program to make this statement. And it was the first statement in the quality standards about the effects of colonization on health and social outcomes for First Nations. So, and by now I believe that there are more of these statements, but it's an example of an indirect contribution that came through the outcome harvest that was extremely significant for forward planning with the boundary partner, with the health system organization. So just in summary then, a bit about this adapted outcome harvesting approach. So it's, you know, the boundary partners, those specific boundary partners, those partners that the program works directly with and intends to influence. And they were engaged as the primary users, and they were also small teams within large organizations. and the descriptions were derived and substantiated through these boundary partners. In some cases, some were validated with, you know, senior executives for sure before they were shared in any kind of reports. But it wasn't, there was never an intention to do sort of externally validated outcome harvest, because the harvest was for an internal learning-oriented monitoring and evaluation approach to their decolonizing and anti-racist work. So, and the focus being on this co-ownership, so that it wasn't about accountability in the same way. Though I think that is the journey that, and why hasn't the Indigenous Primary Care Council adopted outcome harvesting and outcome mapping in a more broad sense? It's largely because there's a huge mind shift that needs to happen in healthcare, and I'd like to talk a little bit about that now as I'm closing. First of all, some of the benefits that I heard about outcome harvesting and outcome mapping, they align directly with a study that was done by the outcome mapping learning community in 2014, which is called the Outcome Mapping User Barometer. Darn, I've just forgotten the name. Anyway, I'll put the link in there. But basically, the users of outcome mapping, and this is what I also heard from the boundary partners about outcome harvesting, they felt that there were some really concrete benefits of outcome harvesting. So a lot more time was set aside for data collection and analysis. There was a lot more trust built across the partners that, using the social actors, using the outcome harvesting language. There was more learning about the context and strengthened relationships, and a lot more learning from less tangible and unexpected changes. So this sort of outcome mapping value barometer, it is directly, I think, attributable to the benefits and values of outcome harvesting as well. And the mindset shifts that need to happen to adopt outcome harvesting and outcome mapping in healthcare are the same mindset shifts. And so this really made it a lot easier for me to combine outcome mapping within an outcome harvesting, where outcome mapping failed or was not able to hold up to this Indigenous context. The outcome harvesting was able to be adapted and support then the boundary partners to understand the journey that they were on, and then to be able to step out of a colonized mindset long enough to determine what an ideal outcome challenge, an ideal journey looked like. So these are some of the essential skills that that made it easy to build capacity for me with the team, with the boundary partners on outcome mapping and outcome harvesting. Because outcome mapping, they're both really a mindset, this mindset to this actor-centered behavior change. They really rely on a participatory, relationship-based approach, and they're very learning-oriented and adaptive. So there's a lot more time sense-making and reflecting. And so the reason that that I bring these two pieces together is partly because I was asked to do that. Originally, when I presented this, it was more about the outcome harvesting approach. I'd like to leave us with a call to action that I feel very strongly about. And it's really this COVID moment that we are in right now. The systemic inequity has become, highly visible, and it's becoming clearer and clearer, and that we find ourselves in an opportunity to use outcome mapping and to use outcome harvesting to advance systemic inclusion, equity, and gender transformative practice. And I think in Canada, particularly, we're grappling with things like, COVID-19, but also, police brutality and really adopting anti-racist practices is taking shape or taking form. So it's a time for evaluators to really simultaneously think about, how we diversify our teams and the cultural appropriateness of our practice, how we include more cases. And so this is what I'm suggesting here, how can we really learn from and benefit organizations that are adapting and using OM and OH? I mean, how does this presentation benefit those organizations? Can we invest in those organizations, build their capacity to share how they're adapting these methods? So that is, that's it. That's my presentation.
Thank you,
So I
Heidi.
stop sharing now?
Whatever you like. Maybe some people will want to go back to one of your slides.
All right, I'll keep
Thank
the slides
you.
up there.
Great. Thank you. Thank you very much. As you said, we already have some questions in the chat. So I would like to invite people to ask the questions themselves if they would like to. The first one is from Diouf. Would you like to unmute yourself?
Yes, thank you. And thank you, Eddie, also for this wonderful presentation. My question was asked in the chat, how do you steer your approach in adapting outcome mapping, outcome harvesting with the developmental evaluation of Michael Patton?
Yes, thank you for that question. So first I want to point out that I didn't adapt. I really supported the adaptation was led by the Indigenous organizations. They were the ones that really recognized the limitations of the outcome mapping approach in a colonized context. And then I did support the adaptation of the outcome harvesting. I think that that example of the land acknowledgements is a good example of, if there was a way to coach the boundary partners to, a developmental approach, that would be something that would, again, have to be led by Indigenous organizations, because even with a developmental approach, unless you are, having those transformative experiences, you're not going to shift your attitudes and your behaviors out of this normative view that we have had for so long, which we don't even see. That we call it unconscious bias, although I tend to call it conscious bias. And so I think developmental evaluation needs to be included as another area that requires a decolonized approach and thinking through.
Thank
I don't
you.
know if that answers your question.
Thank you.
Happy to email me and we could talk more about it.
More to talk about, but yes, I understand your point. Thank you.
Okay.
Next question is from Ponge. Ponge, would you like to unmute yourself?
Yes, thank you so much for the wonderful presentation. I wanted to find out if there is a difference in the harvest process by simply bringing up the terminology of boundary partner vis-a-vis social actor. Are these terminologies mutually inclusive or exclusive? Thank you.
Okay, I'm going to start this and then I'm going to invite any of the facilitators to jump in. I think they're not mutually exclusive, but I think that there's a difference, because social actors is a much broader set of actors within and outside of a very limited system. In this case, a boundary partner exists within an organization. So I would say that they're still change agents through which you're working with. They're still primary users of the harvest. But they are different social act. Well, maybe Carmen, can you jump in and how would you describe the difference?
Well, boundary partners are the social actors you work with, and social actors within outcome harvesting are actors who not necessarily are working with you, or even actors that you were not expected to influence. So it does go a little bit broader. Boundary partners is the social actors you expect to influence and work with, and social actors can be unexpected actors that you have influenced. Connie, would you like to add?
No, not really. It's indeed the outcome mapping is an elaborate planning tool, and that is what outcome harvesting does not necessarily do. So a boundary partner is an organization that you define beforehand, like that is an organization that you want to influence. Whereas in outcome harvesting, you take a more open stand, like even whatever you plan, you may have affected or influenced others. So it's a more general social actor.
But this is in a monitoring context, right? So maybe in a monitoring.
Not necessarily, is it? Yeah.
Yeah, this is only in a monitoring context. We only used outcome harvesting in a monitoring context, in an ongoing monitoring context. So that always means it exists within the context of a program of some kind, right?
Yeah, but I just meant to say that a boundary partner is an organization that you, at the time that you plan, that is an organization you intend to influence. Whereas outcome harvesting is not so concerned with what you're planned, because outcome harvesting is much more adaptive or accepting, if you like, the fact that we're in complex, if not chaotic situations, and that you may influence any organization regardless of your plans. I'm exaggerating a little bit, perhaps,
but I think it's interesting because these are such massive organizations and the sphere of influence is such a small team. So in a way, it's interesting how there's embedded in that is this larger group that you don't plan to influence, but they couldn't possibly.
Oh, you're freezing.
Oh, she froze.
Oh.
Yep, you're back.
Anyway, yeah, so they couldn't possibly influence these massive organizations, but yes, so they focus.
But just looking at the differences, I would say within outcome harvesting, boundary partners would be part of your social actors, if you would like to see it like that. Mm-hmm. Okay, great. Next question is from Michelle. Michelle, would you like to unmute or even
turn
off your video?
Sure. I think this question actually relates directly to what we were just talking about, but Heidi, this is so important for us in terms of understanding how best to support partners that, you know, live and operate outside the usual assumptions that we have in the world of evaluation, right? So I really want to make sure I understand what didn't work and what was the adaptation that was therefore needed. And so to check my understanding, I think that what didn't work was the pre-planning requirements that came with outcome mapping. And so the adaptation was essentially to drop those pre-planning requirements, which implies shifting more towards an outcome harvesting kind of approach. Is that right? Is that correct?
I think what worked for the organization was the outcome mapping, but what didn't work for the organization in connection with their boundary partners was the pre-planning because of the institutionalized racism and so on. So as a tool within the ICS program, it was useful because it allowed them to bound who they wanted to influence in this huge health system to have an impact eventually on health outcomes for Indigenous people, this movement for Indigenous health in Indigenous hands. So it worked for them there, but it did not work for them in terms of planning with their boundary partners. Is that clear?
I think so.
It worked in terms of, it still helped them in terms of the tool of outcome challenge, which they found very useful once they were able to harvest change with their boundary partners using outcome harvesting. But yeah, what failed was that there is no, transformative change pathway that can be planned in advance for this unexpected and unplanned kind of change.
Okay, got it. That's so helpful. It leads me to a follow-up question as well, but I don't want to hog the Q&A, so I'll put it back in the chat window, and if we get to it later, that will be fine. Thanks.
You can go ahead, Michelle, because I think there's only one more.
Go ahead.
We have two more questions. Yeah, go ahead, Michelle.
As I've listened, Heidi, I also want to ask more about specifically what it was that didn't work about the progress markers in relation to the boundary partners, because At first, I heard that through my own experience, which is that a lot of partners that sort of operate outside the typical evaluation assumptions just aren't that invested in pre-planning, right? It doesn't fit their cultural mindset and their way of being. But I think what you were saying was something slightly different. You were saying that the progress markers didn't work because of the institutional racism. If I would love to hear more specifically about.
I think it's a combination of factors. For one thing, it's a highly accountability oriented environment, right? Mm-hmm. So what people know about what progress looks like is accountability indicators and that kind of measurement. And so I've seen that often, that until organizations see what the unexpected kinds of influences that they're having are, they don't really know how to even dream what they could be doing differently. And I see that in the not-for-profit sector a lot. I also see a lot that groups who are disempowered aren't able to imagine what it looks like to be empowered because they aren't there yet, because they have, a lot of basic needs. So those are two kinds. In this case, a third example is where it really wasn't possible because within a colonized mindset, or within a kind of a normative mindset, your ideas about what the change pathway looks like are not clear because you don't really understand the journey in any kind of deep way. And so you can't understand the journey in any kind of deep way except in partnership with the power and privilege and leadership coming from those who've been oppressed. So it's much, much bigger than, it's like nothing about us without us, but it's also bigger than that too.
Okay. That's so helpful. I think I get it. Yeah, essentially the progress markers, if the progress markers had been identified prematurely, they probably wouldn't have represented actual progress.
And with unpredictable change, how do you, how are you able to determine what success looks like when there's so much unpredictable and complex change going on, until you see what that change is and your collective contribution to it, and then you can say, oh, we've contributed to all this advocacy change. Now we're going to focus on advocacy in this deeper way, right?
That is so helpful. Thank you.
Okay, I want to go to Ponga because he had a question also related to progress markers, so we can continue with the. Ponga, would you like to ask your question?
Yes. I would like to ask the question, although I know partly it has been responded to in the two questions that were raised by Michelle, but I just wanted to find out with regard to progress markers, it's already an acknowledgement of pre-designed or predefined outcomes. So does this therefore mean that by design, the process was only meant to harvest predefined outcomes? How then would you differentiate this with outcome harvesting that works from the outcome itself, whether intended or unintended, and then works backwards to find out how the intervention contributed to the outcome? Thank you.
The outcome harvest was not intended to monitor for predefined outcomes. It was only looking at, remember the question was really about to what extent the program had built the capacity of its boundary partners to work more effectively to reduce. So in that sense, no, there were not predefined. The outcome harvest was only adapted in the sense that it was the primary users were these social actors that were within the sphere of influence of the program. Does that answer your question?
Okay. Thank you. I get it. Thank you so much.
Yeah. Okay.
Yes.
Thank you. Next, I want to go to Eda. Eda, would you like a question or unmute yourself?
Yes, thank you. Good evening, all, from wherever part of the world you're coming from. Mine, as I've asked in the chat, I just wanted to know mostly about how to bring the acceptance of outcome harvesting, particularly in the health sector. I'm glad Heidi give examples more on the health sector. With my background in health, I know much of what is emphasized is the use of numbers, the quantitative part, and the experimental surveys, especially if when it comes to influencing things like the policy, the budgeting, the funding, and the rest. So maybe you could touch a little bit on that if you don't mind.
Sure. And I think, I do believe that there's a very significant mindset shift that's required. And in health, it's particularly challenging because of the dominant perspective. But it's this mindset shift of the actor-centered behavioral change, outcomes versus outputs, that idea of contribution and not attribution, and systems and complexity-informed approaches. And most of the work I've done over the years in healthcare has been using outcome mapping by stealth. I have not always declared like we're doing outcome mapping here, but it's continually bringing in that actor-centered perspective, that behavior change perspective, and defining outcomes. And if in healthcare they choose to diminish these outcomes as process outcomes, and they don't have the same value as, you know, these downstream health impacts, but more and more there's recognition for the realities of complex adaptive systems. There's even more appetite now with COVID for reflection and learning. And so I feel like this mindset shift is really key for us in using both of these methods in healthcare. Is this really understanding this contribution, not attribution. That's why I've had a lot of opportunity in these areas of collective impact, you know, where you know, something like Indigenous cultural safety is owned by more than one organization, ultimately many organizations. So you know, if there's a movement like the movement for Indigenous health, Indigenous hands, or other movements, that's usually a way to begin to create that conversation around needing to shift our mindset and our methods in healthcare to really be able to redesign inclusive systems. You know, health equity is like that tweaking. Remember the boys behind the wall, and they have different sizes, but we're not doing that health equity work. We're trying to do that transformative, empowering work where we reduce the barriers. And we can't do that without this mindset shift. So you have to become a real advocate. You've got to get your elevator speech together when you're confronted by an epidemiologist that is like completely numbers oriented. You have to say yes. And we know that the culture and the learning culture is what is perpetuating racism and these health impacts. And we need to address, you know, whatever your conversation needs to be, but call me if you want some support. A long haul in healthcare.
Thank you very much.
Thank you, Heidi. Sus has her hand raised. Sus, would you like to ask a question?
Yes, I think I just forgot a little bit to take it down again. It was not that important, but I'll just comment a little bit. I think the point is that outcome mapping is getting, of course, more natural to talk about this when you have the experience with outcome harvesting before. So I feel now we have introduced outcome harvesting in Dignity and in this consortium that I'm in. And I think it would be down the line much more easy to start talking about outcome mapping. But still we will also face resistance, because already now when we just take the next step sort of to ask them what could be expected outcomes by these social actors that you're trying to influence here, they reject a little bit. So it's already a step. So I see that you can use it later on to build when people are more confident with the method and so forth. I have another question to you though, if I may.
Go ahead. Yes, go ahead, of course.
You say the primary users were these boundary partners. So how exactly was the findings used? What processes, what setup, and maybe you talked about it in the beginning, but could you tell a little bit more about it?
Yeah, so we did workshops with the boundary partners to learn and build their capacity to identify and describe outcomes, so to use an outcome harvesting approach within these small teams, so that they could then also go forward and continually at different cycles of monitoring use an outcome harvesting approach themselves within their own organization. So it's really like a trainer approach. And they were not subject to, you know, rigorous planning or accountability. They were all kind of, they all were required to do a training, the Indigenous cultural safety training, but from there on, it really depended on how motivated they were. So in some cases, there were book clubs that were starting, there were advanced training that was requested. So some of the boundary partners, you know, really went on their own journey to take on the ownership and drive this change within their own organizations. So the ICS program, they've just really gone back to using, to trying to get an outcome mapping approach, because they're unfortunately needing to demonstrate, you know, their contributions. So the outcome harvesting piece is more a legacy that is being built within the boundary partners themselves to learn. It's a learning oriented monitoring. You know, that's the idea. How they can go beyond just accountability. I don't know if that helps to answer, but I could get more. I could if we could get some resources, so I could ask the ICS program to write this up, because I think they weren't going to use outcome harvesting. They were using outcome mapping, and it wasn't working. And because they asked me to come in, then I was able to say, well, this is a natural place to use outcome harvesting. And I think you're right, in the context that you all work in internationally, outcome harvesting is leading the conversations and allowing and creating space for outcome mapping. In the context that I work for, nobody's using outcome mapping or outcome harvesting. So the fact that someone's using outcome mapping is because they're really innovative, and that's an Indigenous organization that really don't fit in the boxes, and then they're leading with it. But I want more outcome harvesting in Canada, more outcome mapping. It's a very different context.
Thanks.
Thank you, Heidi. Michelle just shared a link about related to the broader theme of decolonizing program planning and evaluation, about something, a new effort taking place in the USA. You can chat.
Great.
We have a last question from Connie.
Oh, Connie.
It was actually, you said, it was early in slide 6 that caught my attention. You said we cannot use outcome mapping and outcome harvesting in the context of systemic racism in the way it was designed. But why is that? And I'm particularly interested for the outcome harvesting part. Why do you think that you cannot use that the way it was designed?
Because I think outcome harvesting, for example, the principle of harvesting observable outcomes, right? As an example, I think in a decolonized context, those outcomes have to be about power change. They have to be about power sharing or a shift in power. They can't just be observable outcomes. There has to be a lens that's sort of added, an equity focused or informed lens that has to be added. I think in general, outcome harvesting can be adapted very easily to equity focus by, you know, looking at the principles and making those principles more equity focused. What is social change? What kind of social change are we talking about?
I am saying that you cannot limit yourself to harvest observable behavioral changes. Is that what you're suggesting? Because that's like pretty fundamental.
I think that the problem is that the observable behavioral changes they have to be observable, they have to be valued, they have to be significant to the Indigenous organizations above and beyond any other. They are not just observable changes that are relevant to the organization, because then they're not decolonizing. To be relevant observable changes, they have to be relevant to those who are experiencing oppression and racism. So I think that's the subtle change there. So you can use outcome harvesting, you can harvest all the outcomes you want, and you can say we contributed and they're significant. But if the people who are saying they're significant and the people who contributed are not from Indigenous organizations, then it's not working. You are potentially perpetuating the same kind of lens that you're bringing to what you say are observable changes. It's
so you would need like Indigenous partners to be involved in the identification of outcomes and giving sense to them and identifying contribution.
And more than being involved, way more than being involved.
Well, being the users, right? And
being the users,
Okay.
being the leaders and the users. And that's why I think outcome harvesting is very easily adapted by just looking at the principles and saying, you know, the observable change has to be about shifts in power. We're not tweaking our systems to be inclusive. We're reconstructing our systems from the bottom up to be led, to be decolonized. So, but outcome harvesting is pretty good in every other way except that way, I would say. Outcome mapping is got more to figure out to bring that forward because of planning.
Okay. And
Great.
Okay. Thanks.
Thank you, Heidi.
Okay,
You left
and
us with
we have more in common than we have separate, I think.
You left us something to think about. Great.
Okay, thank you so much.
Our time is up, so I want to thank Heidi for sharing her experience on this combined use of outcome harvesting and outcome mapping. Thank you everyone for participating in your engagement, asking your questions. We will send around the link of the recording, which can also be found on our website. And I would like to invite you to our next webinar to be held in September. We will send an invitation shortly within the Outcome Harvesting Community Forum, where we will mention or give more information about dates and time. For now, thanks again to you, Heidi, and also thank you, Connie, for assisting organizing this. And thank you everyone for your participation. See you next time.
Bye.
Bye. Have a good day, everyone.